So there are different structures in the spine that cause pain in the back. These are the muscles and soft tissues and ligaments on the back. These are the joints called the facet joints on the back. The sacroiliac joints on the sides and the hips that people refer, they also cause pain. And these are the lumbar discs or the cushions between different vertebrae. They also help. You see, God made the vertebral segments to bend and bend forward, backward. They're not made to slip forward and backward. So as we're bending forward and backward, the jelly that is inside, that's sealed around by multiple layers of ligaments, the ligaments start getting stretched, and slowly, the ligaments stretch out and the gel starts leaking. It is generally referred to as a degenerative disc. Now research shows that most of us, or at least half of us, have a degenerative disc by the time we reach somewhere in our 30s to 40s. And different studies quote different numbers. And the general accepted consensus is that half the people, at least with a degenerative disc, do not have any pain from it, and the other half may have mild, moderate, or severe pain that may be intermittent or constant. So it is very, very variable. So there are different factors in the rate of leakage from the disc, how much inflammation it's causing, because the stuff that leaks out has acids and chemicals and causes inflammation. So whenever we have someone have lower back pain, that tends to increase with sitting and driving, which is just across the central lower back or may radiate to a hip or sacroiliac joint to be precise, and down the leg. We understand that the back pain is probably from the discs, and the hip and leg pain is probably seemingly sciatica. Now sciatica can be from arthritis pinching a nerve in the corner where it's coming out, or it may be from the disc that's bulging and pinching the nerve right around the corner. So as long as we're treating the back pain from the disc, if the disc is unstable, it'll cause back pain with sitting, standing, walking, bending, twisting, lifting. No matter what, it'll cause pain. So what do you do for that? Research shows that medications for inflammation like ibuprofen, Aleve, Advil, they can make a difference if we're able to tolerate them. Research shows that strengthening the spine and core makes a difference. Exercises make a difference consistently in research. Other than that, physiotherapy, chiropractic treatment can make a difference. And then we move on towards injections. When we have just back pain or mostly back pain from a degenerative disc that has reasonably maintained its height, the injections are not that effective. They can help, but not necessarily as much as the patients who have a lot of sciatica. So what do you do for those patients? I mean, you can cauterize the disc, and the results are mixed. There was a procedure called IDET, I-D-E-T, and that was overrepresented what it could do, and that was minimally invasive. We saw the success rate was lower. Now we see that today's treatment or tomorrow's treatment is regenerative medicine. So if you look at the studies from Dr. Gregory Lutz, L-U-T-Z, from Hospital for Special Surgery in New York, he's showing excellent results with PRP in comparison to what the controls were doing. So patients tend to do very well with PRP, but going one step further, you can go into regenerative medicine with stem cells, etc. And I've been doing these procedures for the last 4 years, and it helps most people. Now, does it help everybody? The answer is no. But will it help majority of patients? Majority of patients, probably 70-80%. Well, in my experience, yes, it makes a world of difference. And I've seen pain go from 8 out of 10 to 0 to 1 out of 10 in 2 months. And I've seen pain only improve 25-30%. So yeah, and I've also seen pain not improve at all. But majority of patients, I think, when they see improvement, they see like 70-80% plus improvement. So when you compare it to what lumbar fusion surgery offers, it is an amazing outcome. So we will take it from there. So next time you have back pain with reasonably preserved discs, please send us your MRI, talk to us. Let's see what you have and if we are able to make a difference in your life, hopefully. Take care. Bye.